Hello, my name is Jessie. I am the local food associate here at Northlands, and I've spent the last roughly 15 years working at the grassroots level to increase the awareness and the scale and scope of local food and local business here in Edmonton. I've done everything from work with local farmers to get more products into independent restaurants, work collaboratively with independent restaurants to sort of change the dialogue around local restaurants and chain restaurants. But with everything that I've done, the institutional food is probably the most complicated, the most frustrating, but potentially the most impactful. So it was really exciting to be part of the McConnell Foundation work and to have an opportunity to work with a number of stakeholders in Edmonton, but also to learn from other people like myself working in other communities on similar problems. So we had 8 projects from across Canada. It included a full range of institutional procurement. So we had post-secondary schools, secondary schools, so elementary schools. We had a number of healthcare supply chains that we were trying to figure out. Campuses, and then convention centers. We really wanted to use the scale and the power of institutional procurement to help develop regional supply chain for sustainable food. The Ecology Action Center is in Nova Scotia. Justin was the young man that led this project. He was really committed to getting sustainable fish into some of their hospitals. So typically the hospitals in his region had used frozen fish fillets, and he worked over 2 years to increase the amount of fresh, sustainably harvested fish into their hospitals. He had great success with 2 chefs, and then when the chef moved on or was assigned to a different hospital, he lost a lot of the relationships. So it really reinforced that having champions in institutions are important, but also building more formal contracts help reinforce the relationships. The next project was in New Brunswick, and this was an interesting project because it was 25 elementary and junior high schools that all had cafeterias in them. And it was a group of women that they used the cafeterias to feed the students, but also to teach food literacy to the students. So the students actually helped prepare the food in the cafeteria to serve to the other students. And when they started, they had a little bit of local food in their cafeterias, but they didn't have a ton. They had to rebuild distribution channels to get more local food into those cafeterias. By the time they were done, they had up to 60% local ingredients in all of the cafeterias, and most of them were sourced from farms right in that region. Their biggest challenge was having the farmers scale up and access. So how do we get the food from the farm to the cafeterias? So understanding some of the gaps in the distribution channel was the biggest challenge for that project. Concordia University in Quebec was a little bit of a different situation because they work with Aramark. So Aramark was their food contractor. So for people that aren't familiar with institutional food service, there's typically 2 different models that are used. One is when the university hires the cooks and the chefs and a food purchaser, and they run and serve their own food service. The second model, which is I believe the more common model, is the university contracts a food service company to come in and run their food service operations. And so some of you might be familiar with names like Aramark or Sodexo or Compass. Those are some of the larger companies that do some of the delivery. So Concordia had to figure out how to use their contract with Aramark to increase the sustainability of their food service and increase the amount of local food. So this project really highlighted the need to have clear definitions, clear evaluation points, and consequences, targets and consequences. So saying something like, we want to use more local food, and you have a 5-year contract to do our food service, is not going to get you anywhere. Saying, we measure local food this way, this is our definition, we will evaluate you quarterly based on your purchases. If you do not hit this target, these are the consequences, or you risk losing your renewal. It was really fascinating to learn about just the complexity of managing that RFP with a food purchaser, or with a food service provider. They were quite successful, though, because when you actually lay out those expectations in your contract, the food service companies can deliver it. So it's not a matter that Aramark can't do it or they won't do it. It's more a matter of, what are we paying them to do, and what is our expectation? So often, companies like Aramark or Sodexo or Compass, or even the distributors like Cisco and GFS, they take a bit of a whipping from us for not supporting local food. In the end, they'll deliver what you contract them to deliver, and if you lay it out in your contracts, they'll do their best to deliver it for you. This was a hospital program where they wanted to get more local food into a hospital. And it was challenging because it was dealing with a patient care side. So typically, hospitals have 2 different sides of food service. One is the patient care, so the food service delivery that feed all of the patients in the hospital. And then there's the retail side. So that is, if you go visit someone at the hospital and you eat in the cafeteria, or you buy a coffee, that's the retail side. So the patient care side is it's tricky, because a lot of hospital patients have very specific dietary needs. Low salt, lots of really smooth foods are required, and they tackled the patient care side. So they started a garden, and they did a small CSA program, and they managed to get 10% of local ingredients into the patient care side, and 20% on the cafeteria. Typically in healthcare, the retail side is much easier to get local food into, because the specifications are not so complex. It wasn't an easy project, though. We actually toured this hospital, and one of the successes they had was working with some local apple growers, and they used local apples to make a fruit crumble that they baked in the hospital and delivered to all of the patients. They didn't offer it all the time, but in the fall they would do it occasionally, and it was really interesting to see that kind of a product served to the patients in the hospital. I think it was probably the most delicious hospital food I'd ever seen. So. Oh, this was a long-term care facility, and one of their challenges was they had used processed food for a really long time, and as they moved to wanting to go more local, they struggled with cost. So they actually had to do a lot of training with their staff on how to actually prepare and utilize more of the animal and more of the fruits and vegetables. So they managed a lot of their cost, or the increased cost of local ingredients, by utilizing more of the animals and getting better utilization of the products. I remember learning how their staff had to learn how to debone chickens and take chickens and make chicken stock, and instead of just ordering the chicken breasts. So that was something that they had really focused on, was teaching the staff how to prepare food from scratch. They also had some issues initially with volume. It took 2 or 3 years for some of their farmers to have confidence in scaling up their production to meet their needs. So it was a long-term project. It didn't happen overnight. And then there's us at Northlands. So we took a slightly different approach than most of the other projects. We took a bit of a regional approach. So we worked with a number of institutions in our region. So there was ourselves, Shaw Conference Center, NAIT Food Service, so that's the part of NAIT that feeds the students, not the culinary school, the main campus at the U of A, and the Augustana campus out in Camrose. We also worked with Cisco and GFS because practically the vast majority of the food that comes into those institutions comes through Cisco or GFS. And we started by asking Cisco and GFS to inventory all of the products that they carry to figure out what was local and what wasn't. So we realized that we were already using a lot of local products that we were unaware of. I think we found 1,700 products within those 2 distributors that fit our definition of local. And we also shared amongst the participating institutions who had direct trade relationships with certain farmers or certain growers or certain producers. And we shared that information so we could leverage and build on each other's relationships. We also pooled our volume in some instances, and I mean, it seemed like it should have been a relatively simple thing to do, but it turned out it was really complicated. Northlands wanted to use Vitality Tea, which many of you might know is a small organic tea producer. Vitality, they source their black and their green teas from out of country, but they get a lot of their herbs from a local organic herb farmer in northern Alberta. We didn't want to buy direct because it was one more invoice and one more delivery that we didn't want to manage, so we guaranteed to Cisco that we would use enough volume if they listed their teas, that we'd pull enough volume to make it viable. But then we realized we had a contract with Starbucks that also included all of our tea purchases. So we had to go to Starbucks and negotiate that we could get their permission basically to use a local tea product in conjunction with their tea that they were using or that they were selling. So it took us probably 8 months from the time we talked to Vitality and got the samples and said, oh yes, we'd like to use this tea in our facility, to actually getting the appropriate permissions, getting it listed at Cisco, and then getting it into our back door. So we did it, but it wasn't easy. And then I think once we had it listed at Cisco, there were a few others in the region that said, oh, well, if it's at Cisco, then we can buy it too. So last time I talked to Fanta, she said that the volume that she saw just pulled through Northlands increased the revenue of her business by over 10%. So it just speaks to how some of these small vendors, it's complicated, it takes a long time, but it can have a significant impact on their operations. We also, here at Northlands, and I think this was common through a number of the institutions, we realized that we really relied on relationships to manage our food procurement. So the relationship our chef had with certain vendors, the relationship we had with Cisco or GFS, the relationships our food purchaser had, and we've seen some transition in the last couple of years in staffing. Anyone that lives in the region is aware of that. And that really, really made some significant differences over a very short period of time to what we were buying. And it made us very, very aware that we needed to move from being so relationship-based to being more systems-based in how we were purchasing product. In BC, we had some folks that were working. This was probably the hardest project of the entire country. We had some folks that wanted to get more local food into the Vancouver School Board for their school lunch program and their snack program. And given that it's BC, and we all know the food culture in BC, we thought this would be a relatively easy thing to do. And in the end, I don't think they actually ended up purchasing any more local fruit. And it was because of the complexity of the procurement and the budgetary constraints. So it was something that, you know, over the 2 years that we worked on it, they had modest success, but not nearly the scale of success that we anticipated. And I know they're still working on it, so. And then Feed Comox Valley was out on the island. Sandra was working with a hospital and a campus to increase the amount of food, but it was very specific food, so food that was grown on the island. And the island doesn't have a huge ag industry, so it was very, very specific crops. She had to work really, really hard with the region to help them understand why local was so important, and had to walk them through an entire kind of education on what they could do and what they couldn't do, because they were worried about trade agreements. So it was really a focus on how far can public sector institutions go, and where do they run the risk of violating trade agreements. And then they also ran into issues around distribution. So the island has a vibrant grassroots food community, but they don't have a lot of access to distribution. So you end up in another situation where you've got farmers running around with trucks dropping stuff off everywhere, and we all know that's not really very efficient. So the lessons that we learned was there's often local food available. We just often need to work together to find it. And that sounds like that maybe doesn't make sense, but we had some instances where, is everyone familiar with private label? It's when a company will make a product and slap another name on it. Frequently distributors like Cisco or GFS do prepare private label products. And when you get the box in your building, you have no idea where it comes from. When you work with them to figure out where it came from, turns out a lot of it comes from Alberta. So it was really interesting when they started saying, oh, well, this pizza crust that you buy is actually made by Crustcraft, which is located in the West End. And these carrot sticks that you buy are actually carrots from Alberta that get cut into sticks at Sunfresh Farms, and then we put our label on them and send them to you. So working through the supply chain allowed us to really uncover some products that we were not aware of. There are lots of challenges in moving from direct relationships to working small and medium companies through the supply chain. Understanding pricing, understanding distribution, understanding timelines are really, really important, and being really upfront with small businesses, that it might take 8 months for us to use your product, but stick with us and we'll get there. Menus. Typically in food service, you design your menu and then you source to it. So you will do all of your menu development, and then you'll buy your products that you need for that menu. We found that it was actually much more important to understand what products were available in your region and then build your menus. So make sure your culinary team or your R&D team have really, really clear understanding of what is grown and raised in your community. And then buy-in. So whether you are buying local food for health reasons, whether you're buying food for agriculture outcomes, whether you're buying food because you want to support economic development, being clear on why you're doing it and what you're trying to achieve, and sharing that is really important for institutions to be successful. We did learn that it can have some significant impacts when you pull local food through existing supply chains. Some of the rules of food procurement can be changed to level out and provide access for more small producers. Food service contracts are underutilized and really, really important. Often when institutions sign food service contracts, they're for 5 years. So if you don't write the right language into that contract and the right definitions and the right expectations, you pretty much have no recourse until that contract comes up for renewal. And working together and sharing best practices, sharing successes, sharing failures is a really good way to help a region or a sector move together faster. So I think that's, I built this slide just because when you first start thinking about institutional procurement, you think, well, how hard can it be? Well, this is a simplified diagram of the various different steps that food goes through from the farm to the actual institution. And you can see there's 5 pillars. The 4th pillar is where the food is prepared and served. The 5th are the contracted food services. So if you look at the blue arrows, that's sort of the way the food flows and the relationships flow. And the orange arrows are where all of the contracts and the potential revenues flow. So it's different in every institution. It's different depending on what sector that you're in. And there's all sorts of complexity. But when you can get it to work, it has significant impact. So thank you.